From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Welcome to the Psych Health and Safety Podcast. My name's Peter Kelly and I'm your host for today. Unfortunately, Hattie's had some IT issues down in the deep dark south. It's just going to be me and my guest. I'm happy to introduce what, for me, has probably been one of the inspirations for much of the work that I've done over the last 25 years. And I would put him in the legend category. So if you could introduce yourself, who is the special guest today?
Great talking to you again, Peter. It's been many, many years since we've been friends. My name is Cary Cooper. I'm Professor of Organizational Psychology and Health at the Alliance Manchester Business School at the University of Manchester. And I've been working in the field of workplace mental health and stress prevention for many years.
You have indeed been working there. And so, you know what, Cary? I mean, we've sat down on many occasions, including in Euston Station a few months ago. I'd be really keen to know what got you interested in work-related stress, and particularly sort of, what we now view as psychological health and safety at work. And am I right, Cary? Are we nearly at 50 years of work here?
Exactly. Well, probably even more. Well, its origins are more than 50, but it's definitely been 50 years. Basically, I started working in this field in about 1974. But I think what stimulated me came before that. In other words, when I was a student at UCLA and doing my MBA, as a working class lad, I had no option but to work while I was doing my undergraduate and my MBA at UCLA. And I got a job in the summer working as a social worker in the city of Watts, a very deprived Black area of LA, as a full-time social worker. And it was only supposed to be summer, but actually it carried on because I really enjoyed it, and they allowed me flexibility to fit in the work as a social worker. And I was looking at deprived areas of LA. I was looking at the Black community in Watts, but I was also looking at people who were homeless in the city center of LA. These were my clients. And although my trajectory was supposed to be that I was going to maybe become a tax lawyer or something like that. All my friends were going into the law. We all came from Eastern European Jewish backgrounds, most of my friends. And I was first generation American. And I was going to be this lawyer like everybody else. But what I saw in Watts, what I saw among the homeless, made me think I can't do that. I've got to do something different. So I started taking psychology classes. It was actually a part of my MBA anyway, because I was doing a behavioral science MBA. And then I thought to myself, I've got to do something that's more meaningful than helping people avoid tax, or, have to pay less tax, or whatever, becoming a tax lawyer. So in the end, I shifted. And that, I think, made me think about what contribution could I make. Then go back up to about when I entered the University of Manchester Institute of Science and Technology, UMIST, in 1974. One of my wonderful PhD students was doing a project with me. One of the first projects I did when I arrived. She was doing a project. We were jointly doing a project with a big international company, and we were looking at why senior executives were not prepared to move from one continent to another. And so we were looking at mobility among senior execs, and this organization was having difficulty getting their senior people to go, and this was a global company, to go from one country to another country as part of their career. when we started to delve into this, these were early 1970s, we kept hearing the word from these people, stress. I don't need the stress. I have a family, young family. I don't want to shift them around the world. I don't care how much they pay me. Um, it'll be a much more stressful job for me, adapting to a country, but also taking that next level up. So we kept hearing the word stress. At that time in the early 70s, there wasn't much research on stress. The major research was done at the University of Michigan looking at role stress, the role I play at work and how that might stress me, how much control, how much conflict I have, and topics like that. But that was the only thing. And that company we were doing the work for, we said, okay, we're doing this work for you, research, applied research. Would you give us access to all your senior people? And there were about 250 at the top of the organization. And they said, sure. And I said to my PhD student, why don't we shift your work? Why don't we look at stress among senior execs? Not many people have done that. We have access to all these people and data as well on them. And that's how we started the work. So the first study I ever did with my PhD student was on executive stress, looking at the people at the very top of the organization. And from then on, we started to publish on that. And then all sorts of unions, senior management would get in touch with us in a variety of different sectors and said, can you come and do some work with us on that? We're finding that stress-related ill health is starting to increase in our organization, and we want to try to nip it in the bud. So that's how basically I started.
Yeah, isn't it funny though? The same things we're talking about then, we're still talking about now, aren't we, Cary?
50 years
Which
later,
is
I think we've
yeah,
made a lot of progress, Peter. I'll tell you what we've done. I think we've gone just beyond stress management. So in the 1970s and 1980s, organizations were into what do we do to help people manage stress, whether it was doctors, nurses, IT people, senior managers, whatever occupation. And I did something like 85 different occupations, from airline pilots to people working on oil rigs in the North Sea. I've done all that and published tons of papers and books on all of these things. But at the time, it was about let's identify what the problems are and let's help people manage their stress. And the focus then, early on in the 70s and early 80s, was how do we help the individual cope with
yeah,
a bad job or a very poor organizational culture. So the orientation was on the individual, not on the organization itself, and how do we create the right kind of climate. That's how the research started to morph as we got into the 90s and the 2000s into, yeah, we have to help individuals cope with their job, but we also, and that's the individual orientation, but also how do we create well-being cultures? How do we prevent stress in the first place as much as we can? There'll always be a need to focus on the individual to some extent. But if you change the culture of the organization, and that's the construct of well-being in a sense, workplace well-being, then maybe you will minimize the damage that organizations do to individuals, and then you can focus more on the individual. And that's where we are, and we're making good progress on that. That I must admit. And it's not just about. I mean, obviously, it's partly about what for example, NIOSH, the HSE, the Health and Safety Executive in the UK, and many international health and safety bodies are concerned about, which is, mental ill health in the workplace, the common mental disorders of anxiety, depression, and stress, which are in the developed world the leading cause of long-term sickness absence. Absolutely no question about it. And by the way, it's been the leading cause for decades. So
yeah.
that is certainly that is certainly one of the drivers, Peter, I think, that by organizations. But I think another driver, an important driver in recent times, say over the last 10 years, has been what a senior HR person said to me in a meeting I was in. It was in a bank, having this meeting with an HR director. And I said, you guys have never done anything in the field of kind of stress or well-being. Why are you doing it now? And he said 2 words: regrettable turnover. I thought, that's great. I have to write a book on that. So what do you mean by that? And he said, because of what happened in 2008 to 2015, the financial crisis, we have lost so many people that we can't afford. We're now mean and lean. We can't afford to lose anybody else. So what he meant by regrettable turnover is we can't afford to lose key people we currently have, and we need to attract people into the organization. So we better change the culture. Lying down and, on beanbags and having sushi at your desk and massages and the well-being day is not the solution to this problem. We have to change the culture. So for the last 10, 15, let's say 15 years, there's been a move toward how do we change workplace culture so it doesn't stress people out, so people feel motivated, they feel they want to stay, people are attracted to that organization, and they deliver to the bottom line in terms of performance.
Yeah, I mean, you've been doing this for 50 years. I've been sort of chipping away at for 25 years. What's it for me, right? I've always felt the evidence base for what it looks like is very easy. It's clear. Yeah. So the evidence is clear that we can describe what stress looks like. We can describe what mental ill health in the work. One frustrating element and is we haven't really got people to do research on interventions. What works when you've identified the problem? What does that look like? So do you think that we've talked about making positive strides in getting people to assess the culture, but where do we sit on interventions? And why is it that, well, I know there are probably several reasons why people don't do intervention research, but is that not the next thing that we should be, the thing we should have been doing for the last 25 years, not just the next thing, but what are your feelings on that? So it's about.
Yeah, I think you've hit a really important point here. And part of the reason people don't do research on that is because it's not easy to do in a real live working environment. Randomly controlled experiments, randomizing our samples and doing very good systematic research that you might do in a biology lab. We just can't do that. And that's one aspect of it. And it is complicated by that. That's one. But the other aspect is who's doing the research. It tends to be academics who do this research. And they find it very difficult to publish in journals that there are not many journals that will accept articles where it's not randomized control groups and the rest of it, very systematic. Therefore, they find it difficult publishing. However, that is changing. And I've had 3 or 4 PhD students in recent years who've done intervention studies which are not as well controlled as they could be, because you're operating in a real live environment. You're operating in organizations, workplaces, and they have published. So it's getting published. Therefore, it's encouraging people to do it. It is more complicated because things intervene in between as you're doing real live intervention studies. You can do it on training. That's not difficult. If you're looking at a training intervention, those are reasonably easy to do. But there's a whole range of interventions that are more complicated to look at. And so the PhD students and the people doing this research go for the easy path. And that's why we don't have as much.
Yeah.
But the good news is that more and more researchers and scientists are saying, hey, we need to do this stuff, and we will find outlets. And they have, and journals are becoming a bit more liberal to allow this to occur, because we need the science. We need to build up the science on interventions, and we're getting there.
Yeah.
So I think there is hope, but you can see what the constraints are being. Randomized control studies are just difficult to do in a live organizational context. But I have a
Yeah.
PhD student now who's doing interventions on email. So email interventions in in one big government department and one big multinational, and and she's just submitted, and she's having her viva in the next 2 weeks. Really great piece of work.
Yeah.
Difficult to
And
do, but she did it. And that's the kind of thing we need. We need the new generation of people who are less constrained, who said, I think this is important, I want to make a contribution. And when you do intervention studies, you do make a major contribution, because the studies on the link between stress and individual health outcomes is already been done. We know what causes people to get stressed at work. We know all the factors. Yes, there are some new ones, but we know what they are. And that science, I think, has been done, and that's been easier to do. Now we're having to go into a new generation of study, intervention studies. They will emerge, they are emerging, and we will be able to understand what works and what doesn't work.
Yeah, and Kerry, when one of the difficult things, with when I was working in HSC, is you go into an organization saying, we want you to control and manage the risk here. What are the hazards? But actually, when they're saying, okay, if I do that, but what works? And we were constantly looking for examples of what works, and if you went purely back to the academic literature, you would get things that there's a very limited research base that said what works. It was interesting, and when you came forward with Asset, your tool was a very practical example of doing things to help the organization to identify. And because I don't know about you, but I've watched since lockdown, and really during lockdown, there's been an absolute flooding of people coming onto the market with goods, with apps for this and apps for that. And when you actually sit down and look at the evidence base, so the evidence base for like the management standards, the evidence base for Asset, there was a solid amount of work that went into developing that. But I feel that maybe what we've got now is such a disturbed sort of space of apps that we don't know what really does work. So do you think we will eventually get to a more systematic approach to how we hopefully can do this? Because it just feels a little bit messy when you've got an app that has no evidence base, but is out there and supposedly helping people.
Well, sometimes the apps are there to make money for the people who develop the apps. They're easy. Employers buy them because they're easy. Listen, we make this available to our employees, and then we're in the well-being space. It's got to be strategic. This whole area has to be strategic. Let me tell you what I think the future will hold in this area. Okay, number one, we'll have the science. We'll have the researchers in universities throughout the world, in Australia, the UK, the US, all over the world, doing research, more intervention type research, more answering the question of what works. That I'm not worried about. I'm seeing the progress of that. Here's what really I think I'm pleased to see happen. So I had a University of Manchester spin-off company called Robertson Cooper, which I sold a couple years ago. But one of our clients was a big construction company. And this is from an intervention point of view. What I liked about what they did is this: they had a director of health and well-being who reported both to HR and to health and safety within this big global company. Okay, but what was good about them? And this is why we need kind of strategic well-being. And this is why why you're looking at the baseline within an organization is this. What they did is they used to quarterly on their senior leadership team, this is the chief exec and his team, quarterly spend an hour every quarter looking at employee health and well-being. So here's what they did. They used to do diagnostics like using an asset and things like that to find out how people perceive their organization. They'd see a problem in one part of the organization and they would do themselves the intervention. So the asset tool was very useful in helping them to focus in on what a problem was at a particular moment in time in that organization. That in that particular part of the organization there would be one problem, and another part there might be another problem. They do the interventions, and then they would actually collect the data before and after the intervention, and that was presented the next quarter to the board meeting, to the senior leadership team. That's the way the intervention should actually work. So you get the scientists on the one hand doing their research to try to answer the question of what works. But then you get the organization themselves saying, let's find out, let's get employee voice. Let's measure frequently how employees perceive our organization. Let's identify the problems early. Let's decide on working with the employees, decide on what intervention will work in that context. Not just assume you know what will work, that you think, oh, well, we find that overload is a problem, therefore we'll put more people on it or reduce the overload. It might be more complex than that. So you have to ask the people at the coalface, is this accurate? The diagnostic tool, in this case, asset says it's X, it's overload. How would you deal with that overload in the context of your work? And they come up with the best solutions themselves, the employees. Then you do the intervention, but you measure before and after what's the impact on labor turnover, on sickness absence, on performance, and see, does it work? So organizations themselves should be doing this. The problem, of course, is that's okay with big organizations like the big construction industry, big IT companies, etc. But what about the SME sector, the small and medium-sized enterprises that don't have much HR, certainly don't have occupational health? How do we help them? That's another really important area. And in the UK, for example, the 60% of people working in the private sector work for an SME. They don't work for the big boys. Only about 40% work for the big organizations. And that's a problem we have, is we have to think about how we help the SME sector. But for the big ones, they're beginning to think strategically. Let the senior leadership team or the board, I would even go further than that. I'd say that on every board of every company, we ought to have a non-executive director who's responsible for employee health and well-being. It is such a critical issue for not only the health of employees, but from the point of view of the chief finance officer and the CEO on the performance and productivity of that organization. So if they say the most valuable resource we have is the human resource, then put it at the core of your strategy by having a non-executive director on the board, ensuring that the organization actually delivers in terms of employee health and well-being.
Hi listeners, Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia and myself and enjoy learning from the best, then the Flourish DX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all FlourishDX Academy courses included within the FlourishDX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with FlourishDX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
Yeah, and I mean when Dennis Stevens and Paul Farmer did the Stevens and Farmer review, Dennis was very keen that actually health and well-being was a reportable item on the board, and effectively, if it's on the board and part of the board, then you're going to get a more positive.
It will get done. Peter, it will get done if it's on the board. You think about this. For decades, we've had a gender wage gap. We've had that. We still have it, but okay, it was really bad for decades, right? In the UK, when it was made reportable, in other words, the organizations had to report the gender pay gap within their business, that gap narrowed dramatically. That's because the board looked at it and said to the leadership team running the organization, you got to deal with this. You, HR director, that's your responsibility. The gender pay gap is high. It's making us look bad. Get a hold of this. Deal with it. And they have. Once it's a board issue, if the board says, why do we have such high stress-related sickness absence in our organization? Why is our labor turnover very high? If we have somebody on the board saying that on behalf of employees, in a sense, on behalf of HR, saying we have a real problem here, then going to the HR director or the occupational health people and saying, you got to deal with this. This is way too high for us. It will get done.
Yeah, and I've seen that. If you issue a notice, Cary, it does get onto the attention of the board very, very quickly that we've done something which has raised our profile before the regulator as we did. And I mean, interestingly enough, HSC was approached about 5 years ago to get involved in ISO 45003. So the international standard on psychological health and safety and well-being as it became. And I'm interested in your thoughts, because one of the things we've always had in our armory when I was a regulator was the regulations, Reg 3 requiring, from the management reg, requiring you to do a risk assessment. Reg 5 showing some way how you're going to improve the hazards that you've found. And so if you look in 45,003, many of the things that we've talked about are in there. I know they're in there intentionally. And I'm interested, had we said 25 years ago, hey, Cary, do you reckon we'll get an international standard on psychological health and safety? I think we would have just probably laughed, wouldn't we?
Yeah, I think they would have done. But I'm glad. See, we need that. We need actually, like, for example, just in a company, I've been on the board of a number of companies, organizations, and when we do a risk register, which you always do at a board meeting, right?
Yeah.
Increasingly now we're seeing things like stress or well-being as a risk factor. We're looking at labor turnover as a risk factor. Are people leaving the organization? We're looking at stress-related ill health. Mental health, particularly mental health, has become very, very significant and popular by organizations to focus in on. So we're beginning to see, and once you have a risk register for the board of an organization, the board of a company or public sector body. Remember, in the UK, it's strange because the only organization to have a non-executive director on its boards, would you believe, in the UK is the National Health Service. Every hospital now has a non-executive director on its board, and that person's responsibility is for the health and well-being of the staff in that hospital. Now, that's what we need to do, is see that in the private sector now.
No, absolutely. I think and that's the, I guess that these are the golden eggs that we looked at. You remember we talk about what we'd like to see and what would be the perfect outcome. Cary, I'm going to take you right back to the beginning with this question. If you had a chance to go back when you first started out as a PhD student in psych health and safety, what would have been the best bit of advice you would have given yourself, given where you're now?
I guess the best advice I would have given myself would be to be brave and to try to do studies that could make a difference and not take the easy route. But PhD students and their supervisors, I think, tend to do research which is, maybe in a way it's totally understandable, because you want your student to achieve success. You want them to become an adult academic, and to do that you need a PhD. Therefore, let's go that route, which is an easy route, and you'll get it. But I think if I had a PhD supervisor who was very good, and actually, in a funny sort of way, I didn't actually do a PhD on stress. I did a PhD on T groups, the impact that T groups are having on people's behavior. It was almost like psychotherapy for normals. T groups. It was run in the 1960s and early 1970s, and in a way, I was very lucky to have a PhD supervisor, fantastic man, who enabled me to do what I wanted to do, which was in a way a kind of intervention study, because he asked me to go and look at the running of T groups and see what was affecting the learning behavior of people on it. Did their behavior change as a consequence of this? So it was a kind of intervention study, a more controllable intervention study, but it was. So I'd like to see more of that, of enthusing students to try to make a difference. And particularly now, when we need these kind of intervention studies, I wish supervisors would be more ambitious, braver, and get their students in this field to try to answer the question, what works, to help us collect the evidence so that we know what works in the context of the workplace and in context of employee health and well-being. I'd like to see that. I don't at the moment I see some of it, but not a lot of it. Because remember, supervisors themselves don't want their students to fail. And they're worried that, oh my goodness, they'll never publish this, or they'll be criticized in a viva, etc. But that's our future. We have to just be brave in this thing, just like organizations are becoming more brave themselves and looking at this as a strategic issue, putting it on the board papers or putting it on the senior leadership team's papers for meetings. I think we have to be brave in collecting the evidence from a higher education perspective.
Yeah. I'm the same principles that you talk about in that relationship between supervisor and the person sorry, what's the term, the technical term, and the candidate, the PhD candidate. It's actually the same as a relationship you have with your boss at work, isn't it? In terms of like support and actually trying to get the best things out of it. So I think it's something that, whilst work and the workplace has a huge role in taking forward some of the work that we've done around workplace well-being. When it first hit the ground, we had mindfulness, and when we had resilience training, and then we had the crystals in the 90s, and then where people were much more down to the individual interventions. I was getting excited, Cary. I was getting excited. We were starting to look at organizational interventions, and I really hoped that as a consequence of what we've been through the lockdowns and and COVID, and that was actually we might actually kickstart this whole bit of work about getting organisations to manage work-related stress at source, but to promote mental health. Yeah, and if you think about like the World Health Organization, right, last year come out with prevention, promote, protect, and support. What is that, Cary? That's primary, secondary, and tertiary, but it's been rebranded and relabeled. Yeah, and ultimately, well-being and health, that prevention, promote, that protect and promote, which is the central bit of what the World Health Organization has there, is where we're at. Let's create workplaces that create healthy people, and let's put protective factors in, and that's taken us right back, I think, to the days when we were looking at, back to the 1970s. Don't you think creating the right workplaces that give people the ability to go home healthy?
I think what is really significant now, and I'm so pleased to see, is organizations are now focusing in on not just the stats that say long-term sickness absence is primarily due to stress, anxiety, and depression, the common mental disorders. They know that, and they want to deal with that. But what I think is really driving them is the need for retaining and attracting a new generation of talent. So the Z generation, the young millennials, these people, everybody calls them snowflakes. They'll flip from one organization to another if they don't like the culture. And organizations get it now. And if we're to attract these young people, then we have to create the right culture. They're not actually snowflakes. They just won't put up with what their parents put up with. Their parents, to pay mortgages, were prepared to stay in crap jobs, in lousy organizations. These kids, first of all, most of them can't afford a mortgage, right? So they don't have the commitments behind them. They won't get that till they're about 35. What they want is good quality of working life. They want to work hard, but they want to feel valued, trusted. They want to have get up in the morning and going to work and pleased to be in the workplace because they're going to make a contribution and their organization is making a contribution to society. So the retaining and attracting that generation is a big driver for organizations now. So how do we create the culture? And creating the culture means being much more strategic about this. It's not just beanbags. They're not looking for ping pong tables, these kids. They're looking for good quality of working life, where their line manager, which is really important. It's another problem we have, I think. The untapped, the real submerged problem in the well-being and stress field is the fact that we have the wrong kind of line managers in place now. In other words, we have line managers from shop floor to top floor in most organizations in most developed countries who are there by dint of actually having a good skill base. In other words, they're recruited and promoted based on their technical skills, not their people skills. That's a big untapped area, by the way. So that will require a strategic approach. What we need in that, and young kids, remember who influences you the most in your job? Your boss, your line manager. If we have people, a high proportion of whom don't have the good people skills, we got problems. And so unless we tackle that and ensure in the future that we recruit and promote people to managerial jobs where there's parity between their people skills and their technical skills, this problem will continue for a while. So that's another major area. We talked about intervention studies, but then another biggie for me is we don't do a good enough job in thinking through, in promoting somebody to a management role or recruiting them from outside. Are they good people skills? Will they be people who will make people feel valued, will have a good management style, which manages people by praise and reward rather than fault finding. People who will be good listeners. That is the kind of line manager we need all the way up the hierarchy. And the good news, I think, is employers now, big companies and organizations, are beginning to realize how important that is if they want to reduce stress-related sickness absence, but get higher productivity, which is a big issue.
Yeah. So the landscape's looking good. Finally, one very quick piece of advice you think you could give our listeners as to what is important in right now to tackle work-related mental ill health and to promote mentally healthy workplaces. So we always end with one last very quick bit of advice that you'd like to give the listeners. So
okay, if you're somebody if you're somebody working in this field, if you're an HR person working in a big organization or occupational health, I would say the following. If I had one thing to do, in fact, I was just talking about it a minute ago. If I had one thing I had to do to try to change it, but it needs more than that. It needs a more strategic approach. The one thing I would do would look at the issue of the line manager. I think that's really fundamental. Your boss, people don't leave a job or an organization, they leave a boss. And that is so fundamental, particularly for the next generation who want to feel valued and trusted and the like. So if I was to give one piece of advice, focus in on the people you have in line management roles from the bottom of the organization all the way to the top. Give them the training they need, but ensure in the future when you recruit them or promote them that you get a parity between their people skills and their technical skills. And that, I think, would go a long way to creating the right kind of culture.
Brilliant. And as always, Cary, I could talk for hours with you about various different things, but unfortunately, they've given me a time limit on the podcast, so we need to finish. Yeah, I know it's been great to continue this journey with you, and over the years and many times that we've met, and we had really, at times challenging and interesting conversations, but actually, long may you continue to be an influence in this area. And I look forward to having further conversations with you. So what Absolutely. I'd like to do.
It's been great over the years working with you, Peter. We've worked together for God knows how many years now, at least 25. And yes. It's been a pleasure. And you've done a lot through the Health and Safety Executive to make a meaningful change in this area. And it's great. We have to keep up doing the work because the health and well-being of people at work is really important. It's not only important for the organization, but it's important for their families.
Yeah, absolutely. And, you've always been a constant source of encouragement, but also challenge in equal measure. So I think that's a really good thing because, you've sort of pushed us along that way. So what I'm going to do is obviously now as we come to the end of this recording, I just want to remind the listeners that you can listen to us on the various different formats that you listen to your podcast. And we hope that you will. Also, you can find us on YouTube. And so it leaves me to simply say thank you very much, Cary, and we look forward to the next chat.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.